We have a saying in the disability community, which is nothing about us without us. And any government system, any organisation that wants to take decisions about our lives, about the way in which we receive services, needs to have us involved from the earliest possible point to ask us, what do you need? How do you need it? To understand why the outcomes should be the same, but the way in which the different services are delivered might change from one person to another person.
The ACT government is a very inclusive government, so there was a strong focus right from the beginning of the program to make sure that people with disability or people with mental health or people who weren't keen on getting vaccinated had the same level of access to vaccines. So that's why we set up this clinic. We had great support from the community sector and from individuals themselves to make sure that it was fit for purpose.
It was a really good experience for me as an autistic person because he was very calm, it wasn't rushed. He gave me options, he helped me understand what to expect on the day at the clinic. He also asked me what I needed and what my support needs were and assured me that they were things that could be met. So things like having a support person present and not having to go through it all alone and having someone explain to me what was going on and walk me through the form filling out process. These were all things that helped give me a bit more confidence about what to expect from my vaccination experience.
6 months ago, when the vaccinations were at their height, the least quiet places in the ACT were vaccination centres because we're urging all the population to go there. So the community said we'd like somewhere that allowed people with disability to come if that's what they needed, so that they could get a slightly differently organised way of getting the same vaccination as everyone else in the community.
It's really demonstrated in our vaccine uptake that people with disability really valued this service. So we have very high vaccine coverage for people with disability, and of course that's contributed to our outstanding coverage across the territory.
And the idea behind the Access and Sensory Centre is that it would be, in addition to the other vaccination options that were available, all the vaccination centres in the ACT are accessible to all Canberrans with disability, but some of us need some kind of reasonable adjustments, as we tend to call them.
It was one of the first times in public since the start of the pandemic where I felt that my different existence was completely ordinary. It made me feel quite validated and seen. It made me feel like a person, which was fantastic.